This is the Southwick Board of Health meeting, Thursday, July 4th, 2024, 6 p.m. in the land use room. The hybrid meeting, present at the meeting is Sue Braska.
Mackenzie Kane.
Tom Hibbert.
Megan like
Tricia
that.
Sedlow.
Okay. We don't have any public comment. The minutes, Mackenzie, do you have any questions or changes or anything, revisions for the minutes
Nope, they look good.
from December 7th? You want to make a motion to accept them?
Yep, I will make a motion to accept last month's meeting minutes.
A second it, all in favor?
Mackenzie Kane, yes.
Braska, yes. Okay. Nursery report from Tricia.
Yes, so December was pretty busy with a lot of influenza cases in all our towns, and sorry, COVID-19. I'm not reporting that on the list anymore because the numbers are only PCR testing, but we had a lot of people take COVID tests. We have none left. We're trying to get some more from the state.
Just got 900 this morning.
We did?
Yeah.
Okay. So there we go, and I'm sure they'll be gone in no time because people are really asking for them. On your minutes, I put down a Mass DPH has a new reporting site for respiratory illnesses, and I gave you the link if you're interested in looking at that. It goes through like weekly what the hospitals are seeing, so it's pretty interesting.
Oh, all right.
It,
So where
it
is
should
that?
be right before the listing of the towns, the infectious disease. It should be in blue or black if it didn't print color.
Respiratory illness reporting.
Yeah. And then I
Megan,
also gave you, I know when I saw you last, Sue, you were asking about what the new COVID strain is, and it's there as well under WHO News. They're calling it JN.1. And that's what's rapidly spreading around right now.
and the vaccine is not effective against that variant? Or
I
they
don't
know?
think so. I don't think they know yet,
Okay,
but that's the new strain. And
Yeah.
I'm sure you're seeing on the news that the hospitals around us are masking up again, so.
yeah.
Yeah.
So this
Um,
site, Megan, did you email it to Mackenzie and I and Terry? The nursery report?
Yeah, yes, I did.
Okay, so
Mhm.
we do have it.
Yep.
So we can look it up. Okay,
And I
good.
had, because I'm still doing the Chris's 3 towns, Blandford, Montgomery, and Russell for investigations for communicables. I do have a case right now I'm working on. It was a Shiga E. coli, and the person was a food service worker. So I had to exclude that person from work. So that case is currently going on right now, taking a little bit of my time.
Good. All right.
But other than that, I mean, it's pretty much the same every month. The meetings and so on.
Well,
Let's see. Or here,
Yeah.
where
I
we-
have to have my back.
yeah.
Yeah.
With the water, you know, in case bushwhackers come in.
It's your folder.
Thank you. And I can sign it. I saw that email.
Okay, so Terry Putnam has joined our meeting,
Hi, Trish.
Hi.
and Mackenzie's on too.
Hi, Mackenzie.
Hi, Terry.
Okay, so Tricia was just giving her report for December.
Yeah.
Down the stairs and in the hallway to your right. No problem.
Um,
Just.
Oh,
Oops. He's getting a lot of exercise out of that.
Yeah.
Right here.
you went the right way.
Okay. Anything else to add? Continue or?
No, I think that's it.
All right,
You made your thing.
so Marianne Demings, correct, did I pronounce her name right? She's gonna
Yes.
start on Monday,
Yes,
being with
Yeah,
you
Yeah.
and Tom. Go
Yes.
over-
yeah.
And, keys, laptop, phone.
Jim's working on the laptop today. Trisha was working on her, I guess, training schedule and orientation. I've been working with Nadine and Laura and Jim to get all the contracts. Actually, all three of you board members should have got an email from Adobe to e-sign Mary Ann's contract. Rather
When
than,
we've gotten that.
it just went
Yeah.
out, like I sent it at like 4:15 or
So I
something.
didn't see it.
Yeah, so, and it's not.
I got it, yeah.
Okay,
You
yeah,
got it?
so it's pretty easy. I think you just click the link and
You do.
check, and that's it. So,
So we don't actually sign it, we just check.
yep,
It's an electronic signature.
yep. Yep, I figured with Mary Ann being up in Tolland, it was easier for everyone to just e-sign it rather than pass around a paper and have it be a
I'm gonna send
mix.
it
So
back to you.
it automatically goes back to me, so you just have to click the link and check it a couple times and then that's it.
Okay, be asking you how to do it.
Yeah.
Okay.
That's fine.
Okay,
So yeah, so that needs to be done by the end of tomorrow, because she starts Monday, so we just have to have the contract signed by then, so. So if you can do it tonight or tomorrow, that would be,
Probably do it before.
yeah,
All right, is there anything
yeah,
else?
Sue, if you want, if you have your email on your phone,
I
you
do.
can do it, and if you have any questions,
Okay,
I can help you before you leave.
okay. We'll do it before we leave and
Yeah.
we'll be done.
So,
I
so
just
yeah,
signed it, so I'm good.
perfect.
You don't need the webinar about doing that, then Mackenzie?
No, I sure don't.
No, I've done those before.
How do I need it?
All right,
Here you go.
So as it worked out, is, her home base gonna be Tallinn? So she doesn't have to come to Southwick?
I think
Mileage, how
we're
it's
gonna
gonna
do a stipend for mileage, so she can be wherever she needs to be.
All right, is that something we need to sign?
Nope, I think with the board for the regional board, I think they'll have to just decide on the rate for the stipend for everyone. And we're gonna switch Trisha to a stipend, and the grant coordinator is gonna be on a stipend, and no one's gonna have to spend an inordinate amount of time logging their mileage, and then another amount of time making corrections when there's problems with it, so.
So the letter of employment, which I've read, is there not a 90-day, no, we didn't do it for Tricia, a 90-day review?
I think that's in there, yeah,
So it'd be a review probably with Tricia,
yeah,
would probably do
Yeah.
a review.
yeah, and that might be in the handbook, as even if it's not in the
Yeah,
contract, I think it's in the handbook as well, so.
Yeah, I don't think it's in.
Yeah, we might not have got it for Mary Ann's, but it will be in the shared service coordinators. And I'm pretty sure it's in the handbook too, so,
Okay, I just signed.
oh, perfect,
well, that was quick.
It's really easy.
yeah. All right,
Or what if I read this, it's a letter of employment, right?
yeah,
What if I read it and I want changes?
then I'll have to make the edits, and then we'll all have to e-sign it tomorrow.
Okay, that's a possibility, Mackenzie.
That's okay, I can re-sign it.
About the 3 months.
Oh, there is a
Yeah,
thing in
I'll
there,
meet with the board 3 months after hire and at least once every year.
perfect,
But that's more, I think, for board accountability.
yeah,
That's not for review though.
Mm-mm.
okay, oh, I thought that was for the
I
review.
thought it was too, but then I looked at it.
Okay,
And is there anything in there that just to report to the board, report monthly?
not in that might be in the job description, but I don't think it's in the letter of employment.
Uh,
But, and they'll need to report to the regional board.
Is
For,
that in
yeah,
there?
no, but that's just something I don't think that needs to be in the job, just in the letter of employment.
Does she already have the job description?
Yeah,
And that's the one that we used for you, Tricia, and for Chris?
Yeah. Yeah, that was definitely in there because we talked about it at the interview and she's
Yeah.
fine with that.
Yeah, and there
and
was
it is,
a lot in that job description.
in the letter of employment, it doesn't say monthly, but I'm pretty sure there's a line about attendance of meetings and
Yeah.
flexible schedules,
Yeah,
so
that
it's.
was,
Is
that
there-
was. the-
Yeah, so it's not so specifically spelled out, but it is in there.
And then it goes to, we got a June 30th, 2025.
Yeah. I
It
think
doesn't really
just,
talk
it's
about
just for,
term.
yeah,
Does it talk about the
It talks
dates?
about commencing on January 8th. And her compensation.
yeah,
And hours of work, and it does say it's grant funded, so, and the termination with 30 days notice.
It talks about if the grant goes, then
yeah, that should be in there.
The position in the event is eliminated, the position will be terminated.
Yeah, I added,
unless we.
That-
can find-
that's implied by the state law, but I added that line in there just to have
Probably
it be upfront and clear.
unless we can find-
But that's implied that if there's no funding, then
And so her professional activities are above and beyond her 15 to 19 hours.
I think so, yeah,
I think that's the way, that's the way I interpret.
yeah.
So Tricia, on your letter of employment, do we have a date on it when we renegotiate? The new one that we just signed?
I don't remember.
I think the regional board, I think they had said they just wanted to do for this fiscal year. So then so that'll work out, cause then in July, we can update for all three, but then all three positions can be on the July schedule. Cause I do think there is something with the grant. I'll have to confirm it, but they don't want you to make contracts beyond the funding year sort of thing. But I don't know if that's different for, I don't know if that's different for employees, so. So I'll confirm that stuff, but I think we'll be able to get them all on the same schedule at least, even if we can't have it be spelled out for, years to come.
So I know we're jumping out of order, but since we have Tricia here, anything else with Mary Ann that we need to discuss?
No,
I don't think so.
Okay, so
Yeah.
do you have any questions about it, Mackenzie? Or anything?
No, I'm all set, thanks.
Well, then we talk about the shared service coordinator since we're,
Yeah, so we interviewed her with the regional board, Sue, Tricia, Crystal from Russell and Granville was there, and Jennifer from Blandford was there. We had
we had.
eight applicants. We interviewed 3 that were qualified. And then we picked one that was our preferred candidate and did a second meeting with her. Tricia was under the weather, so it was just me and Sue that met with her in person. Was that last week?
Yeah.
Already? That was last week, I think. Feels like it was longer, but she seemed pretty good, seemed genuinely interested in the job. So we made the offer, and she has some questions on benefits. So she's gonna be meeting with Nadine tomorrow, and I'm gonna sit in, and if there's any
Good.
questions I can answer that Nadine doesn't know. So hopefully she'll get all her benefits and insurance questions answered and accept the job. If not, one of the other that we interviewed, everyone else seemed to like and think would be a good fit. And then the third candidate, not everyone liked that one, but I personally think that one would have been okay, but if it comes to it, we can offer it to the second candidate or just repost it and see who else is out there. So, cause we did get on Indeed, we got a good response. I think those 8 candidates came in the matter of a week or 2. So hopefully it'll work out. We won't need to go there, but that's always an option if we need it.
When did you say she was coming to meet about benefits?
Tomorrow.
Okay, so she'll be expected then to give
Yeah,
her decision within the next day?
I would think
I would-
early next week.
I would
And
probably set
Yeah.
that expectation
Yeah.
so we don't lose those other.
Right.
people.
Right.
And then when she gives say accepts it, then Nadine will contact the other.
Yeah,
applicants?
yeah, and then I'll talk to her and one of us will do it.
Mm.
But, yeah,
And then it's gonna be 25 hours a week.
Yep.
And, Tom will be the supervisor,
Yep.
whatever we call it.
Yeah.
And she'll report to Tom and Tom will train her and tell her what to do, and she'll get training from
from the state.
the state.
Yeah. Yep.
And she'll, basically work from home, and she has to come in, this will be her home base, but you have to figure out where she would set up.
Yep.
Is this room used much during the day?
Not
No,
really.
No. And how about the little
no.
conference room down there?
Well, most of those rooms are open 90% of the time, so.
Okay.
So if there was really a need that, there was our office was totally full.
We've got
Yeah.
cubicles in planning too.
Yeah, there's a cubicle in planning too, so there's always
We'll get
There's
you
always a
for
spot
it.
that someone could, but we have Megan's desk, cause Megan's not in there, all day,
Yeah, I
every
have two
day.
desks, so
And then Trisha's desk, Trisha's normally there 2 days a week, so,
But then
You know,
Mary Ann might need a
if
base
it-
every once in a while.
yeah. And then we have kind of
She'll probably have oh, yeah.
we have a spare desk that used to be in my office that is pushed up against Karen's desk, but we kind of use that for like landing zone when we're making copies and stuff. So that wouldn't be comfortable for all day for someone to sit there, but
Would be
Um,
comfortable for Karen too. that's
yeah.
where it's close.
yeah, if it was someone was gonna be there for half an hour and, print something out, it wouldn't be bad, but
Is anybody using the desk right inside the door, the second door?
oh,
in
and
there,
That the Board of Health Secretary did use at one time?
that
Nope.
is,
yeah, that one's open.
yeah, that's open, and
That
there's
one's open
another
too.
cubicle, cause we're looking for a floater or a secretary for several boards. And that's Cindy's desk, but she doesn't ever use it, so I
Right.
feel like we could give somebody that cubicle.
Yeah, so
Okay, so.
within a short radius, there's a handful of spots someone could post up for the day or afternoon and get some work done, so.
Okay,
So that shouldn't be an issue, and in the interviews, I tried to make it clear that, you're not gonna have a desk that's yours, but there will be somewhere for you to work that's comfortable and has everything you need. But it won't be your personal desk sort of thing, so.
can be kind of hard. How do you oversee this person to see if this person's putting in the amount of hours they're supposed to put in,
Yeah, I think part of it is there's definitely a, trust element and go off of the work that's being completed and, are the deliverables getting done? Are the meetings getting scheduled and all that? And, if everything's getting done and they're working 23 hours and not 25, and there's no way to really know, but, I think if there seemed to be a problem, I think then you could, implement some sort of tracking sort of hours log, but I think,
it would be nice, we have a meeting this coming Tuesday.
I have to send out an email. I think we pushed it a week,
Oh, so now
so
it's gonna
it'll be the 16th, I think. Yeah,
Okay.
but I haven't sent out the reminder for everyone that we pushed it yet, so. Hopefully that
Okay.
doesn't cause an issue. If we had a grant coordinator, they could have done that, and I wouldn't be able to forget.
Right.
So, but I'll do that. I'm gonna make a note here.
So will she be salaried or hourly?
Um,
Hourly.
hourly, I think. yeah.
Hourly.
Does she do some sort of time?
Yeah, so yeah,
Time.
there is a time card, so. Grant update. So yeah, I have that on my list for tomorrow to send that out to everyone. So
It's part-time nurses hourly also, because she's up
Yeah.
to 19.
up to 19 hours. Okay.
Right, so anything more with nursing or the grant or anything like that? No?
Trish, I missed the COVID. How's COVID in our area? I'm sorry. I was-
Definitely on the rise, and on my report, which you should have gotten on email, the new variant that there is out there is JN.1. So I put that on there, and there's also a link to all the respiratory reporting. Mass DPH created a website, so it'll show you like weekly what the numbers are, and all of them, flu, RSV, COVID. I mean, there's even, common cold, pneumonia, everything's up. So not necessarily COVID's higher. I mean, actually flu's pretty prevalent right there now, but I think this new variant is the problem because I'm not sure if the vaccine's touching the new variant. So I was sick. I mean, I'm still kind of under the weather, but a lot of people are talking about this cold, this cough that they just can't get rid of. And so it seems like more common cold than COVID, but all of them are definitely elevated. We only track PCR through DPH, so there are increased numbers of PCR testing for COVID, but not knowing how many home tests and the results of that, I'm sure the numbers are a lot higher than what I'm seeing as far as COVID. But definitely influenza's on the rise. In all our towns this month, I have reports of influenza in every town. And usually the smaller towns, we get hardly any reports of anything. So to get that many, it's a lot.
Thank you.
Is there
Yeah.
some, on here, do they indicate the percentages for people that are vaccinated? Like in the different towns or the different
I think
counties?
there is, yes, that's there on that report that they do. It's brand new. They just started it, so I'm sure they'll be adding more and more. And there is a separate COVID website.
Yeah.
Not just for COVID, but for flu, like how are our vaccination rates for that?
Right. I've heard everything is down.
Vaccination rate?
Yes. I actually heard it on the news tonight that the rates are very low for COVID vaccination boosters in Massachusetts and all over the country. But I know influenza is low as well. People aren't getting their, annual vaccines, so.
And you sent that out this afternoon? That's probably why I didn't see that.
Yeah, I think Megan sent it out today, right, Meg?
Thank you.
Mhm.
Thank you,
Yes.
Megan. I'll look at that. And did we get the COVID test that we were talking about getting?
Yeah, we got different ones.
Tom, give me this too. Here's
oh,
a
yeah.
copy of it.
Yeah.
Thank you.
I found out I was just about to do the order, to pay for them through our grant, and I found out from Agawam that you can still order them from the state. So I just put in the order 2 days ago and we got 900 tests
Wow.
delivered this
That's
afternoon.
great.
So I put some out in the lobby by the town clerks, and I'll bring some to the library. I know the fire department was looking for some, so I think they're gonna come by and get some tomorrow.
Okay,
So is it a box of one
It's
test?
the 2-pack now.
good.
So it's the same, the orange eye health.
Okay, those
Yeah.
two tests.
Yeah, whereas the last round we got from the state, it was the 5-pack.
Yeah.
Which, I don't know, I feel like people probably ended up taking more than they needed,
A test.
but now it's the 2-pack, so.
So is the expiration date November, but it's good till,
It's, the expiration date was, so I put some out, I didn't even update the sign yet, but I will tomorrow. The expiration date on the ones that I looked at was, December 25th. So I think it's just a 90-day extension, so it's about end of March.
March.
That'll be good till, so, not that people will read it, well, some people will, but not that everyone will read it, but I will put on the sign, expiration date extended and then hopefully.
And they can also go online and find that
Right.
out. too.
Yeah.
They have the stickers, that we put on the boxes. That has a QR code they can scan and it shows the updated, expiration dates, but, not, even when that's on the box, not everyone sees it, so. But we try to get it out there. There's not too many people that come back and say, but it's expired, but there's a few that do, but that's all right, so.
so anything
Yeah.
else? Any other questions? No, so Tristan.
Thank
Good
you.
night. Yep,
Good
thank you.
night. Hope you
night.
feel better.
Thank
Yeah.
you.
Okay, the fat, oils and grease regulations, what did you
Yeah.
get for info?
Oh,
So
boy.
I haven't done much for that one, since we talked, I did talk to Tom Fitzgerald about it. And his recollection, it was probably about 5 years ago at this point. And his recollection was kind of some of the same things that you had mentioned is, you know, who's gonna do the work? We don't wanna create an act of regulation that creates too much work for me that I don't then have time to do it. And then we've created a regulation that we can't enforce. So what was the point in the first place? So,
And then for the grease trap inspector,
right,
you have to go in there and open up the grease trap?
right. So I'm not gonna be doing that.
And what about which places have outside grease traps?
Right,
And how do you, you're
right.
not gonna be doing that?
Yeah, so, so I don't think we should, necessarily rule it out entirely at this point. But I'm gonna do a little more research on it, hopefully once this shared service coordinator started, I'll have a little more time in my day. And then we'll be able to kind of do a little research on it, see what some other towns do. You know, maybe find a regulation that's a little simpler than the one that Randy had proposed, but still kind of meets some of the big things. And then also make sure, because with the grease traps, it's the food code doesn't explicitly, it's more of a plumbing code thing, but all the restaurants have them, and so it's a little complicated between, you know, it goes into DPW sewer. They're the restaurants that we license, and the plumbing inspector is the one who kind of will issue the guidance on what type of grease trap they're required to put in. So with so many people's different hands in it, you know, before we put any even, you know, propose voting on a regulation, I would want to make sure that, you know, the plumbing inspector is good with it, and it's not gonna create an excessive amount of work for anyone.
Well, it's going to for someone.
Yeah,
Is
so,
that a state thing that we're just finding out about?
no, it's a common, fairly common thing, a lot of boards of health, or sometimes it's a town, it could be a town bylaw, like a sewer. And it's often a board of health thing because, you know, because we're involved with Title V and septic stuff, and also with restaurants, so
Mhm.
if they have, they should, all the restaurants should at least have something for grease. It might not be the most up to date, and all the regulations I've seen, including the one that Randy provided, was, you know, for a new restaurant, they need to do this, and it
Mhm.
needs to meet these specs.
Mhm.
And then for existing restaurants, they're kind of grandfathered unless they were doing a big remodel, then, okay, we'll
Mhm.
plan this into your remodel sort of thing, so.
And I'm
um,
sorry, who's Randy?
Randy is, Randy Brown, the director of DPW.
Okay.
So. So yeah, it shouldn't be, well, like a lot of the restaurants already have some level of grease trap, but just making sure it's being used properly and up to date. And I will, when I'm doing a food inspection anyway, I'll ask about, oh, are you know, keep a log, you get it pumped. But I'm not, you know, I'm not, so give me your log, I wanna, you know, check your dates, and, you know, I'm not gonna open up the grease trap.
Well, you're
It's-
supposed to be submitting them to us, correct? And it's supposed to be pumping like quarterly, according to
I
Title
don't-
V?
I don't think they have to submit the, oh, no, yeah, the grease pumping reports, that would be
Pumper.
a pumper, so yeah, they should be submitted to us, but.
But it seemed
But
like it
I-
was very cost prohibitive when it said something about quarterly pumping.
Yeah,
That's-
I think in most cases,
lot
it
of grease.
ends up being quarterly, but it's in Title V at least, it's based off of, you know, they should look in the grease trap every, couple of weeks or month at least. And based on the depth of the grease, when the grease trap is, I wanna say 25% full of grease, then that's when they are supposed to get it pumped.
25%?
Yeah, yeah.
Like 75%.
Yeah, but I think the whole tank will fill with water, but it's just determining the grease level.
Do most of the traps under the sink?
Yeah, I think everyone has the,
Under the
the
sink.
sink traps at least.
You know which ones have it under the ground?
I'd have to look into it, I don't know.
So the expectation would be that you would have to look at those even in the ground?
I'm not sure, I think some of the regulations I've seen would require, like the vent hoods in
Yeah.
the restaurants, they have to contract with a service and they get a
They
sticker.
come in, yeah,
So I think
they're
there's,
just checking to make sure that it's done.
I think there's some of the regulations I've seen are not necessarily the town is, going out, sending a town employee out to look in the grease traps, but it's saying, you have to do this, you have to have it inspected, you have to have it pumped, and you have to provide those records when we
Well,
request them.
And that seems to be doable,
Right.
especially when you get the shared service
Right.
coordinator, but actually
Yeah.
having to go in and,
Yeah, I have to read it more closely. I only, would say I very closely skimmed it. But I think the one that Randy, wrote up, I think if they got it pumped twice in a year, they wouldn't get an inspection. So it was like if they don't meet the, I don't think I included a copy today, but you still have it. If that was my recollection, is if they don't, there was I think it was 2 times a year they're supposed to have it serviced. And then if they don't have it serviced when they were supposed to, then it would warrant an inspection specifically of the grease trap. But then it's still to be determined who's going to do that inspection.
you're
When,
just gonna start driving a little roto-rooter
yeah,
truck.
yeah, I guess so. So,
These are good regulations, but it's just that it
yeah,
makes
just,
it have Tom.
right, we just have to make sure it's
And I
feasible.
can see where he wants a Board of Health regulation, otherwise it has to go through and be a bylaw. And be
Right.
voted on by the town,
Right,
but I just don't want it to fall
You
right,
have to be able to live
solely
with
on
it
us.
and-
Right,
and
right.
maintain it,
Running
yeah.
and-
right, and I'm. No, this is another thing I wanna research more to make sure, but I think in some of the ones I've seen for other towns. Just because it's the Board of Health bylaw. Doesn't mean. We can't allow. DPW employees to be empowered by it, so we could say, oh, DPW can do the inspection or,
Mhm.
but I would wanna confirm that,
I mean, you're essentially doing that already, if
right,
having an outside service
right,
can meet the pumping criteria.
right,
I mean, we're taking that,
right,
and there could be outside services that, it could be part of the bylaws that you're responsible for
right,
having somebody pump it when it hasn't been, or inspecting it, yeah.
yeah,
It says inspection shall be performed by a grease trap interceptor inspector that is licensed by the Board of Health. And then the Board of Health will bill the owner, operator,
mm,
$50 after each inspection.
So that sounds like we could have people who do it, and they
Right.
submit licenses like we get all the other licenses.
right,
Okay.
right. Yeah,
And then in lieu of hiring an inspector, they can, clean it up.
yeah, so. So, yeah, there's
But
There's
I
a
don't know
way.
about billing.
yeah, I
us
wouldn't,
Billing,
I wouldn't wanna get into billing or,
Maybe it's
I mean, we
better as a penalty or something, if they haven't done, if it's been 2 years or
Right.
whatever, then it's more like a penalty rather than.
right,
a
like
bill.
a fine. if you-
Yeah,
Yeah, yeah,
we're
so-
getting in people's business, we don't get in people's
Right.
business.
have to really study this.
yeah, so I'll read it closer, I'll look at some other ones and.
Did you
Um,
send all of us that, did you send? it?
Yeah.
I think I sent it it would have been with last month's meeting,
Okay, I'm behind.
Yeah, that's okay.
The Christmas.
Yeah,
was a
I think
blur.
we're all, I think everyone's a little behind right now.
Mhm.
So yeah, that one, and I don't know if maybe even not by the next meeting, but I was thinking about, I know a lot of other boards have like a old business
Mhm.
on their agenda. So I might put that, I might create for our next month, I'll put a old business and I'll leave it on there. And then whenever I feel like, or if I've talked to you guys separately, and I feel like we're kind of ready to talk about it again, we can bring it back up, but I'll leave it on there as old business. So then the next thing, unless anyone has any other fog questions. Okay, so the next thing is the frozen dessert license.
Right after talking about that's an
Yeah.
oral, go right ahead.
Yeah. So this is a license that
We used to do
we
it.
used to do it. It
don't
looked
know what
like
happened.
right after Tom left, the fee schedule was, because Tom recalls that when he was here, we were still doing it.
Right. I think when Tammy came,
when-
she revamped the fee schedule and
Yeah,
the names of things.
yeah, because I know we were still doing the milk and cream
We got
license, which no one does that anymore. It's still on the books, but
$2.
yeah, the state acknowledges that it's outdated, so they don't care that no one does it, but anyone who sells milk or cream by state law should have a milk and cream license.
So-
Actually, no,
Wow.
we're allowed to appoint a milk and cream inspector. And if we have an inspector, then we can issue the license, but we don't have a milk inspector, so we don't need to do the license. But that law is still on the books for some reason.
So I was looking at this,
Yeah.
for one thing, we would do it from year to year based on January 1st.
I think we
That's how-
should, I think we should stick with what the state law says.
No.
Why
I
not?
think it's too confusing. If Moolish's or McDonald's are gonna come in, they're gonna get all their permits at one time. And they're gonna start at one time, expire at one time, never mind coming in
The-
February to get
I
it.
mean, I agree
And
with,
before it went the same way.
I agree with that,
What
but
does this- what
the
does the state
state,
say?
the state law clearly states the the application shall be made in February and the license year is effective March 1st. It's exactly what the state law
I
says.
think we can vote and do what is appropriate for our town. They're still
Okay,
getting a
I
license.
also don't think it's, it's only 3 businesses, I don't think it's a huge lift for us or for them to, have that extra license. At a different time. But it is your
Or you can
call.
have the license with those dates on it, but then
Yeah.
still,
Yeah, I mean, next
for
year,
it
we
all.
could have it
no, it doesn't make sense.
we could have it on the March schedule, but we could send out the renewal with all the other ones, and if they pay for it in December, we
Mhm.
would just give them their March license.
Did you get a copy of it, Mackenzie? Did you get a copy of it?
I think I emailed it out
I
to
got it,
everyone,
yeah.
Yes.
so,
Did you see that part there where it's good from February to February, where all our other licenses are January to December 30th or 31st?
Yeah.
I'll be honest, I did not look into it in that great of depth. I didn't.
yeah, but
Well, I like your, if they could start whenever they wanted to start, like, we could say, we encourage everybody to put their licenses in January. But if something happened and they didn't, they
right,
wouldn't be overdue until the actual
Right.
state.
It's too confusing. To me, it's like do it all at once.
Well, the only thing I worry about is there any chance that the state could come in? Can states do inspections, or is it pretty much just the local? I mean, I'm talking from a healthcare perspective, and you have
Yeah.
state coming in when you have, your local hospital, and a state kind of trumps everything when they come in. So that's my only concern.
Yeah.
I mean, I certainly like it better all at one time too, but.
They don't often, I mean, things are changing because they did just, release like the performance standards. So they made, and this is on there, they went through all the state laws that are related to boards of health and made like a giant Excel spreadsheet that says everything that boards of health are supposed to be doing. And then also they did that for employees, for like the qualifications for directors, inspectors. So that's kind of all, kind of being worked on, and I think they just came out with the performance standards a few months ago. And they're gonna be hoping to update them as time moves forward, and they want to get rid of some of those ridiculous things like the milk and cream license. So, I don't, from everything I've heard, I don't think they would ever come in heavy-handed and say, you're doing this wrong.
Mhm.
But they might, you might get a finger wag and say, hey, it's supposed to be
Mhm.
this date, but,
As long as it doesn't fall back on us or fall back on the individual business.
Right.
I really
Right.
don't, I
right,
don't have a vested interest when
Yeah,
the
and
licenses are.
I think the best thing to do is kind of do the best of both worlds. And we'll send the renewal with all the others. We'll do it in February, or we'll set after the meeting tomorrow. I can send this out. We'll do it by the state schedule this year. And then for next year, we'll send the frozen dessert application with the food application, and they can do it all at once. And then that way it's all done. But then I put the seasonal establishments. I know Summer House and McDonald's are open year round, but Moolicious, and there's a couple other food establishments, not ice cream ones, but there's a couple other food establishments that if they're not gonna be operating, they don't need to renew in January. But I know for their food license, Moolicious hasn't renewed yet, but they're closed, so. So as long as they do that before they open, then they're good. So I think we can kind of do both. But it's your guys' call.
My thought is to get rid of that and just have it just like all our other licenses when it's due.
So would you wanna,
Wait till next.
I also don't think we should wait till next year, because it is the only one of these that I'm aware of, they could be doing the tests and not be submitting them. But McDonald's is the only one that we're getting the testing reports for. So I don't feel right waiting a year and not requiring them to do because they're testing the bacteria counts for the ice cream
Yeah.
and the soft serve machines. So,
Okay, so on this application, it doesn't say anything about you have monthly bacterial testing performed by
yep,
and it should be something about that, did go to submit the report.
yep, this is the information packet from the state.
Right, but I think
So
we should
that's
get
on.
on there,
Okay, I can do that.
because we're not gonna give them this packet every single time.
Yeah. Well, the results are submitted by the lab usually,
Okay, then,
but I can add that to the application.
Does the lab send directly to us?
Yep,
And so we know that McDonald's is the only one who's been
Yeah.
doing them.
yeah,
and so I know the copy of the state one, but have you received a copy of the regulations? I don't think we're gonna send the regulations out or whatever the first time we do it. I don't think that needs to be on there.
okay.
Just
Yeah,
for
so what I
the
did
interest of
for the application, so it's further back in the packet. I included these, we won't send these out to the people, but this one on the left is the one, if you go all the way to the back. There's one that looks very old and one from the town of Holland.
Mhm.
But I looked at a bunch of them. The one on the left is actually what they still use in Westfield. And it's obviously the original one that was provided by the state. And their state hasn't updated the application for it, even though they required the license. And then all the other ones I found, you could tell it was a lot of the same questions as the state one, but the state one is also designed to be used for like bulk manufacturers, not just, you know, a retail business with a soft serve machine. So location of plants isn't necessary, name of the brand or trade name. So I took some of that stuff off, but and then I looked at this Holland one, I think was the most, kind of updated and also similar to the original state one that I found.
Mackenzie, do you have this on the, your email?
Yes.
So,
Do we need this as the facility constructed and equipped as provided in the regulations? Well, they're gonna say yes, no matter what.
yeah. Yeah, I mean, I think some of those questions, even though they're kind of ridiculous,
You can
it's,
take that off.
it's good to have them, cause if they ever, if there's ever an issue, then you have written proof that they did know the rules.
Yeah, I don't see anything wrong with, I think just adding the monthly performing and submission or
Yeah.
what, you know.
So Mackenzie, what's your thought about, the expiration date? Right now, it's March 1st to February 28th. Because we're talking about that or having it go January 1st to December 31st, like all the other ones. Are you there?
Which must have stepped away.
I'm not there.
Yeah, sorry, I couldn't get my thing unmuted. Repeat your question, sorry.
Right, so our permits now go January 1st to December 31st.
Right.
This frozen dessert permit says it goes from March 1st to February 28th.
Mm-hmm.
What's your thought on that?
I mean,
Well, only because I
I
think
see
they
the
should
validity of doing January 1 to December 31. I do see the validity in that. But also if that's what the state does, I don't know. I mean, I'm indifferent either way, honestly. I think
And
it's
I'm-
easier for the applicants to produce everything all at once, but are they not going to do it if, I don't know.
I think the only other thing is if we ever had an issue and they appealed to the state, like if they did, they're gonna fall within the state guidelines.
for
Right.
2 months.
Yeah, I'm not.
Oh yeah, that's a really great point.
Yeah,
For how many, for what, $20, $25? I mean, what are we gonna
Yeah.
yeah.
charge?
Well, that's the other thing, we have to set the fee
Yeah.
too, so.
Do you know what other towns charge?
So I looked up in the old, annual town report, and it was previously, I think we charged 25. And all the other towns I found were either 50, 75, or 100.
Hmm.
So,
So when
We
you
should
go to
up
do,
some.
when you go to do an inspection, do you?
yeah, so
inspect
with,
To see whether it's.
with the
machines
soft
are
serves,
clean
I'll,
or-
basically what I'll do for, you know, I'll look at the reports, and if they they do the, aerobic plate count and the coliform count. So if one of those, and it kind of all spells it out in this document here. But if one is high, it's not like an immediate, like, shut down. But they would have to clean the machine and, have it
Do a
retested.
retest, yeah.
Cause usually that just means when they did the test, the spigot where the external part of the machine that's not refrigerated wasn't cleaned properly or, something like that. So usually they re-clean it and it comes back fine. And then if it continues to be an issue, if the next result's high, or if month to month, even if it's not over the limit, if every month it seems to be on the high side, then I'll either call or go over there and, you know, they're supposed to keep, cause that's the other thing with the soft serve machines is every manufacturer is different. they're all cleaned differently. They're not, I mean, they're similar, but they're not all exactly the same. So they have to have a copy of the manufacturer's instructions on file available. And they have to have people that are trained who have read the instructions and know how to clean it properly. So,
'Cause
Um,
and things live and grow.
Mhm.
You know, I'm thinking it's not a whole lot different than ice machines.
Right.
And Legionnaires and all kinds of nasty
yeah,
stuff.
Yeah.
Grows there. So you know.
yeah. So,
So this would be soft serve
yeah,
plus milkshake, cause milkshakes usually have a ice cream mix,
yeah, yeah.
so those machines.
And they only have to test one machine. So Summer House has a whole
Do they
row of
alternate?
machines. I think maybe one of each type. Cause I was just looking at one of the reports from McDonald's and they had from the milkshake machine and the soft serve machine, they had both.
And again, if these, and I know, please tell me if you get tired of talking about the hospital versus this, but these machines will have an instructions for use that says how many times they need to be
Yeah.
tested within X.
Yeah.
Do we even know that they know those instructions for use about those particular machines? And most of them will say, you gotta test, you can alternate, but
Mhm.
you have to make sure that this particular machine is tested X times.
I don't know if it goes into that much detail,
And it may not,
but,
and I'm probably reading more into it,
Yeah.
but, I
Yeah.
just know nasty, and McKinsey knows nasty stuff grows.
Yeah.
In that stuff too.
Yeah, and if they do have two of the same, are they gonna alternate?
right,
Yeah,
And they
you don't
should
want them to
alternate.
test the same one, because maybe they're only cleaning that one machine.
right.
Really, you hate to think that way, but there are businesses, I'm sure, that know how to get, not that any of these three would, but,
Right.
a lot of times when you do the colony counts and the cultures and that kind of thing, they will name, the machine
Mhm.
for clarity purposes. So, you know.
Okay.
I don't know if that's
Yeah.
expected here.
Yeah, they normally will just name the flavor. And so it
Okay,
would
the
be,
chocolate machine.
yeah,
is-
so it'll be like vanilla soft serve.
The vanilla's
uh,
30,000 CFUs.
Yeah, or
yeah.
chocolate shake, and then it will be
Oh.
that, so,
So what they have here, this is basically for the Board of Health,
yeah,
not for them. So what is their regulations?
this is it. I mean, it's
I mean, or do we have to look up the Mass General Law?
I've looked up the Mass General Law and the 105 CMR 500. And that's why I just included a link to the CMR on the renewal letter or whatever the letter is. And in my opinion, I've read that and like the state has, they did revise it in 2015, the frozen dessert document here. This has everything summarized that's in the law is in this
It's in
document.
there.
So cause I've looked at both and, when you look at the 105 CMR 500, there's a section for the frozen dessert, but there's also sections for, a million type of other, wholesale things that Board of Health doesn't normally get involved with. So I think it's a little more complicated to send someone to look at the regulation. But this document, in my opinion, has everything important that,
Mhm.
it is written for us, but it also has everything the establishment needs to know.
So they have to have tests performed on at least one dairy-based frozen dessert product per month.
Yeah,
And it needed to go a little bit further and say, the expectation would be that in a year's time, you test all of them.
right.
But it doesn't say that.
Well, Tom could put that in his,
Yeah, I mean, we can't be any less than the state, but you could be
Right.
more stringent.
Yeah,
than
and
the
we
state.
could pass a we could pass a Board of Health regulation if you wanted to kind of expand upon this.
It really, if they're testing the same machine every month, I mean,
Right.
that, we're not really getting a true picture of
Right.
what might be growing out in the other one.
Right, I think in my experience, I think the kind of the intent is if they're cleaning this one right, then they know how to clean them and they're cleaning them all right. But you never know if,
But what if they have different kinds?
right,
And I don't mean to get us in the
Yeah.
weeds in that, but the intent is to make sure that the dispensers are clean.
right,
And we're making sure that one is clean.
right.
Um, And would it be helpful, although they aren't, and when, again, comparing it to pharmacies, when they prepare drugs under the hood,
Mhm.
they have an actionable, they know, they have a chart that,
Yeah.
that tells them. Does Malicious get a chart or McDonald's get a chart of, when your report comes back do they get a copy of the report as
Yeah.
well?
Yeah.
Cause, do they have to wait for us to tell them, this is an actionable?
They shouldn't, they should, in my experience in, in Westfield, anytime I got one, they already knew about it, they've already had retested it in most cases, so. I think the labs are pretty good about, telling them what they're supposed to do as well.
This,
But it-
this kind of alludes to doing all the machines because if there are repeated excess accounts on the same machine.
Yeah,
So I think they're reading between the lines, they're expecting you to do more than one machine.
right,
Okay,
So, go back to
so back to the
The-
amount.
the letter, dear licensee.
yeah,
Um. Deadline does not apply to seasonal establishments, blah, 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 so we just need a period at the end of that sentence.
Oh, yeah.
And then, as you may recall, the law also requires monthly bacterial testing of a sample from at least one dairy-based frozen dessert machine. Not
oh,
product.
okay,
And then would we add a sentence about our the Board of Health expectation is that every machine is tested at least X a year, or that every machine is tested per year? Doesn't mean you have to, if you got 6 machines, you don't have to test them 6 every month, but you alternate and it's not the same machine.
Right, how do you wanna word that?
yeah,
So if you can wordsmith that.
Okay.
You don't have to do it now, but I kind of think we'd be setting the bar for
yeah,
where it should be.
Yeah,
okay.
Are we gonna leave it at February, or you wanna do January to whatever?
well, Tom would like it to go out this year.
Right, yeah, I
so we
don't,
can have it go out this year and then it will go
And then change it for
resume
next
on
year
our
if you want
regular
to.
schedule.
okay,
So maybe we should say that. That starting in 2025. It'll be our regular schedule, June 1st to December 31st.
I mean,
January,
January
yeah.
first.
Yeah, you know, what I mean.
So you don't wanna just send the application? As I think that covers our bases if there ever was, cause the state's never gonna come in and say, oh, you're not.
You're
but-
off by
but
2 months.
I think Terry brought up a good point that if, say there was an issue, there was a lawsuit or something. For them to turn around and say, oh, the Board of Health wasn't doing it right, they weren't following the regulations. So I think if we, and
But the Board
that's
of
kind of far fetched, but it's possible.
The Board of Health makes regulations like our Title V regulations.
Right,
you
but this
know?
is a state regulation and it's,
Yeah, but you got Title V and here we.
Right.
We did our own which pertained to our town.
right,
Or do we leave the letter with the edits that you've, cause this is a state official letter. And maybe have a little checklist that says January 1, get this, this and this in. So that we're not really going
That's
against.
just gonna work for Megan.
I think, in my personal opinion, and I don't think Megan, we've talked about it, I don't think with, it's only 3 establishments, it's not gonna be a huge lift. I think, in my opinion, the best thing to do is keep it with the schedule as written in the state law. And next year, we will just send the renewal and the application along with all the other renewals. So that way, it's simpler for the establishments, they have the option to do it all at once, and then,
Then Megan, are you gonna remember on the license to put the right date for these 3?
yeah, they would just, all 3 of them would just be
We'll have
effective.
to Just issue a,
Yeah, we could send it in January and just put effective March 1st. And
And do we send a cover letter with every license we send
Yeah.
out? I started to say, just take the cover letter.
yeah. Yeah, we do cover letter and application. So I think that kind of meets the state law and also meets the idea of keeping it simple for the businesses and for us
Mhm.
without, without intentionally, shirking the state law just
What do you think?
because the state law doesn't make sense, which
Yeah.
it doesn't.
What do you think,
but-
Mackenzie?
I think that's the best idea.
And your dog agrees too.
Yes. All right, we'll
So
just do
what
that.
what about the fee?
Yeah, so the fee, so ours previously, whenever I think with 2019 must have been the last year we did it, was 25. And then I looked at least probably 5 to 10 other towns. And everyone was 50, 75 to 100, kind of equal distribution, so.
I don't think we need to do 75 or 100, but I think we could go, maybe we don't do 20, maybe we do, 25 this year with a notice that
25.
says we're gonna go up to, whatever.
Considering they have to pay for monthly
Right,
bacteria
pay for it,
Yes,
testing
yeah.
every month.
okay,
What do you think, Mackenzie? 25?
Yeah, I think that's good.
okay.
But does 25 cover your time? How long does it take to go out and do that? I mean, that's kind of what the fees are for.
Yeah,
Does it cover Megan's time? Does it cover your time?
um,
I mean, we're not talking big,
Yeah.
Tom has
No.
to go out anyways to do a food
Yeah.
inspection.
yeah, and so the only
That's what
time
I'm
I would really have to go out and get involved would be if they have repeat
Or
hits are really high or,
Yeah,
but like I had one in Westfield, I won't name the establishment, but it was it was a national chain. They had just remodeled the establishment and brand new, first test,
Ah,
wicked high. And then we're like, all right, maybe the new employee didn't know, clean it and, then, so next month it was still wicked high. So whoever came out from another branch that was owned by the same franchisee, like the regional manager, someone from another store or something came out and didn't train everyone correctly on how to clean it. And they didn't know where the instructions were for it. So
so it's a good idea to do.
so, yeah, so it's like, so that one, like, we went out there a couple times and they finally kind of figured it out, but, that's kind of the most that, I would have to do is, what are you doing? Figure it out.
Mhm.
Call the manufacturer and they did, and, I think they got to the regional manager, someone trained them properly and knew what was supposed to be done, and then it was never an issue again, but,
Mhm. And you
um,
probably didn't find that supervisor again.
right,
Went on to other opportunities.
yeah.
So I know we're gonna wanna get this out soon, so you just make those
Yep.
revisions, send it out, and
Yep,
when you send it out, if we have any comments, we'll let you know, otherwise we'll go with it.
Yep.
And then the application itself, to have some space on it. Yeah, do we need? Cause you're gonna
yeah, I can
you're
add
gonna submit to the Board of
Yeah.
Health, which is already in your
monthly, yeah,
letter, but still, And maybe, do you have to have in the applications or do annually? How are other cover letters? I forgot how I wrote them.
What do you mean?
Did I have in there when their license period begins and ends?
I don't.
No, I don't
so.
think in the other ones, but I wanted to put it in this one because maybe we won't do it
Do it in
next
small-
year.
do it in small letters.
But in this one, I wanted to, just because we haven't done it in a few years, they're gonna get it and be like, what's this? Like, so I just wanted to have it, but I can move that
Just make it small.
lower and make it smaller.
So do we need those last two or both of them? Are you equipped for these regulations or a copy of the regulations? Do you need both of those?
I mean, some of the other towns had like a very even less information. I cut a lot out, but they had even less than this. I mean, I don't think it hurts to have them, but I also don't think we need them. So it's up to you guys.
Okay, so maybe the first time we send this permit out, we'll say, did you receive a copy of the regulations? Which you would, because they're attached, you're gonna staple them
Yeah.
together.
Yeah,
And is your place constructed and equipped right?
yeah,
And then the next time, we don't really need that.
yeah. Actually, I'm gonna change it from receive, cause the 105 CMR 500 is like 50 pages, cause a lot of it is not directly related to frozen dessert. So I don't think we need to send them the whole regulation, so I'll say, have you reviewed the regulations? And not, it doesn't need to be a copy. And that way they would all say, yes, they received them, even though we weren't gonna send them the whole
Reviewed.
50-page packet.
You could say, have you reviewed and do you understand?
Yeah,
And since we have the number of machines they have, can we clarify in the monthly bacterial testing, maybe in parens, that, you test each machine X times per year or
Yeah.
something? However you decide to do that, but
Yeah.
it's in the letter on the other side, so, however you decide to put it.
okay,
Well, it depends how many machines they have, they don't really know how often they're gonna, they just have
Right.
2 machines and hopefully they do each one 6 and 6. But if they have 3 or 4 machines.
Maybe they do them quarterly or whatever,
Yeah.
but,
But just that they alternate machines.
and maybe that's something to reach out to some of the other
yeah.
areas
Yeah.
and see how they make sure that all the
Right.
machines are done.
And I might even reach out to the state on that one and just say like, what do you, I know
Can
I know
they
the summer
type it
house
up?
has a row of probably 4, 'cause I think each one has two different handles, but probably at least 4 different machines, so.
Yeah, there's
It's
some
probably
machines
easier to
that,
do the in machine every time.
Right.
I bet, you got.
yeah,
one
there's
of
some
the-
machines that have 4, 5,
Yeah.
9 spigots,
Right,
depending upon.
Yeah,
Yeah.
that's a good idea. to
so
reach
so
out to
I'll
the
get clarification from the state on exactly how
state.
establishments should be choosing which. And also some of the labs will come out. That's another thing I'll want from the state too, is, there was one lab that I don't think they do it anymore, but they used to let you, the restaurant owner could bring the sample to the lab. And some of the labs will come out
Mhm.
and the lab will say, oh, the store
That would be
won't know.
wonderful. Yeah.
And we're testing this one.
Mhm.
So that way, it's random. So then if the store was deciding which machine to test, then we'll clean this one really good because that's the one we're gonna
Yeah.
test. And then what are they
Maybe
doing? with-
chocolate.
Or if it's
Yeah.
a different guy every time, they're like, oh, they tested that one last time.
Right, right. So,
Yeah, hopefully they'll go, that's
Uh,
fine, we'll test it
yeah.
again.
Yeah, you could call the testing lab.
Yeah.
Yeah.
To see how they do it.
yeah, so I'll first reach out to the state and see what their
That's a good
their
idea.
recommendation is on, and where's that,
The thing that,
The thing that said at least one,
that's on the, uh, here on, under the very last page, or next to the last page, under the Q, when should they
Oh,
take
okay.
enforcement, and then there's, repeated
Oh,
excess
on the same
counts on the
machine,
same
yeah.
machine.
okay,
So that insinuates that you're checking more than one machine,
Right.
but it doesn't specify that.
right,
So therefore, if the machine has a couple units in it, should you use machine? Or should you be using, do they have like, what do they call it? A unit, a compartment in the machine, a unit in the machine?
yeah, I'll get clarification.
Or just
Yeah, and here it
machine?
says,
Be separate freezer.
all frozen dessert manufacturers, this includes soft serve dispensing machines and ice cream barrel freezers, shall have bacteriological tests performed on at least one dairy-based frozen dessert product per month by a certified laboratory. Laboratory must submit copies of the results to the Board of Health
Okay, so-
upon completion
So
of
maybe that word
analysis.
should say product instead of machine.
Yeah. I'll add, I think in our letter, I had took out the parentheses. But I'll add the parentheses back in where it says this includes soft serve dispensing machines. And ice cream barrel freezers, which I don't think we have any of those. It's kind of a weird regulation, cause it includes. Like, you think the state could just take the soft serve machine part and put it in the food code? Cause everything else applies to like Hood manufacturing like thousands and thousands of gallons of ice cream. And the state does those inspections,
Yeah, why can't they?
but the
just-
regulation is the same for that and for a soft serve machine. So it's a little weird, but, I guess it
And a
works.
milkshake machine.
Yeah,
What about when they're making ice cream? Like hard ice cream?
Like a
I think,
brand of-
I think it's only if they're making hard ice cream in a machine. Cause like you can make hard ice cream, you can have the cream and shake it and or do it in a blender and then freeze it in a freezer. And I don't think that applies to this, but I'll ask the state that too, cause that,
There's so many little nuances.
I know,
Yeah.
Ice
I know.
cream,
Do you know, like, does Summer House make their own ice cream?
I don't
Or
think
they
so.
buy it?
I think they buy it.
Malicious makes their
They
own,
do make them,
Do they have hard?
hard and soft.
yeah, I think that.
Oh, okay.
I think
Or
that's
do
right.
they, I know they make soft, obviously, or do they have someone else make the hard and they,
I don't know.
Yeah.
I don't know, I don't know,
too bad Joe's not here.
I don't
Yeah.
know.
I think in Florida,
Yeah,
He is.
yeah,
so yeah, I'll get
Okay, so
clarification
good
on
work on
that
that.
too, so.
thank you.
But yeah, either way, I'll send this out and, we'll get that, with those edits, we'll get that going. And we'll do $25. All right,
So Megan, about the updates, renewals,
Yes, so everything has gone really well. We have just a few companies that have not returned anything at all. And Tom has actually reached out to them, right?
I think so.
So for food service, we had Pasticceria, we had the rec center, I don't know,
I thought we got, that one just came in.
no.
Oh, okay, Thought I saw that
You're
one.
thinking maybe food pantry,
Yeah,
yeah,
food pantry, we don't charge, right?
no,
no.
no,
And
Um,
schools, we don't charge.
and
Nope.
then we had, Dollar Tree does a retail one, and we haven't gotten anything back.
they emailed me, they
okay.
are. I think it takes them a few days to cut the check, but they were,
In the process. of
they were gonna be
getting it.
mailing it this week,
Okay,
so.
and then,
And I told them what the fines were, so,
okay, and then, we haven't received anything from the tanning salons.
okay. I had emailed both of them, but I can visit
Yeah.
them.
Do we inspect them? You inspect them or is it state?
No, I haven't yet, but I think we do. It's pretty
It's state
straightforward.
Regulations.
Yes,
Yeah.
yeah.
So La Patisseria has not,
No, and
it's every single year.
I know, and I went there, cause I got food there before Christmas. And I brought a copy of the application. And I said, I don't wanna have to fine you this year. Please fill this out.
Okay, so when do the fines start?
This week, so it's $50 per week. So $50 this week, next week it would be 100 week after 150, and the week after 200. There was a couple, I went out, anyone who hadn't renewed, I went out, last week, cause there was only like 5 at that point, or I emailed them. But I had said it, if you get it in first thing next week, we won't fine you. So I think Kettlebread was the only one that made it in under the gun.
Mhm.
So I'll send out another reminder or visit and say, this is the fining schedule. We have to fine you, but also patisserie if,
Every single.
yeah,
Fine, just pay it upfront.
right,
Instead of paying the
That's so
fine.
weird. And then we just had like a few delinquent ones,
Yeah.
sort of, for food service, Grist Mill Cafe, we needed choke.
yeah, I think just the choke saving,
Hilltop, which this I'm gonna resubmit, and Mrs. Murphy, so the Hilltop Cafe or bar, whatever it is. They had taxes on property owner had to pay taxes on some of his other properties. So I had to let him know, and then Mrs. Murphy, she had a separate piece of property they owed a water bill.
yeah,
So I'm gonna resubmit them to the clerk's office in hopes that they came in, we let them know, that they came in, but everything else, they're good to go. And then Southwick Inn, I spoke with Jess myself, because I'm friends with her. She needs to get all of her certifications straightened out. Everything expired this year and it was under Chris, who was her former cook's name, and she's got all new management and stuff in there, so she's working on her certifications. Serve Safe, Allergen.
But they pay
Choke.
for their
yeah.
permits.
They pay,
Yeah, she paid for
Just-
everything
just need the other
and,
stuff.
Yeah.
but she's just, everything ran out this year and she really actually wasn't even familiar with it. So we sent her how to get it and
Mhm.
everything. So, I'll give her a call this week too. But that was it. Everybody
Yeah.
else is good to go and in and ready to roll
Yeah.
for the new year.
The seasonal places that, like Edgewood,
yeah,
Yes,
what other places?
malicious.
yeah, yeah, so
We haven't received
Malicious
anything
didn't
from them.
renew yet,
And so do we have to be as stringent?
No.
I
since they're
don't
not
think
gonna
I wouldn't
open?
be. I mean, I would just think when you open, you apply, right?
yeah, I think that's what cause it's a license to operate, and if they're not operating,
Yeah.
they
'Cause
don't
I
need
think
the,
one year Malicious didn't get it in time and
yeah,
they had it, but they don't open until later,
Right.
so in a way.
Yeah, and he hasn't gotten it in.
Yeah,
So,
yeah.
we haven't really been super,
Another one was Red's Cafe,
well, that's, somebody
They-
came in and said she bought it, right? A woman
or
that said
either
she,
someone was thinking of buying, I don't remember, but
yeah,
I emailed the former owner, cause like, they have a big for sale or for lease sign. And then I think Facebook said they closed for the season,
Yeah.
but then I had also heard from a few, I just got a sandwich at Red's yesterday, and I was like, oh, they were closed, cause I tried to go there once to get a sandwich there, cause I had never been there, and I was like, oh, I guess they're closed. So, I don't know if they're opening
and
sporadically
obviously,
or,
Prime Steakhouse.
Yeah.
I mean, Jen did message us to say,
That was.
yeah,
no longer-
it's not open, and
Right.
once we figure it out.
right, I think
Well,
someone told her she needed to renew, and I said, no, if you're not opening it and you're not operating, I think she's looking for a new tenant
Yeah.
to run the place, so when you have someone and they're ready to open, they need to get the license,
Yeah,
but
and
until
even
then,
Victor came in for Roma and we told him whoever reopens is gonna have to apply.
Right,
But he
right.
still got it. He paid for everything
Oh,
anyway.
did?
Yeah.
Yeah.
I think it was something with
He
for
said
the
with his
sale,
son
they
and
wanted
Ethan,
to see
yeah.
they wanna see they had all the permits
Oh, okay.
for the
Yeah.
sale, so I don't think he didn't care that much, but I was like, this is for next year, and you're saying you're gonna close on the 31st, you don't really need it, right? He was like, yeah,
Yeah.
whatever, so,
Okay.
but yeah, with Reds, I just emailed them and said, as far as I can tell, I think you're closed, but if you're gonna reopen, just make sure to,
Yeah.
If you're
Get
gonna
your-
reopen in 2024. yeah.
right,
Yeah.
get your license, so.
Is anything happening with Krabby Joe's? Cause that for sale sign is down.
Yeah,
Oh, is that?
Yeah.
I haven't.
I
heard anything.
heard there was someone, but nothing concrete, so. Could just be rumor mill, I don't know if,
Could just taking it off the market a
Right.
little bit too.
right,
And
so,
Franklin House is no longer, even though the sign's up and everything still.
I think that is,
Mhm.
yeah, I think Kurt owns it. I think that his daughter is planning to, they're planning to get it up and running
good.
again, so.
Good.
I haven't, there was some, with the select board. I had heard, cause they were looking at the liquor licenses that weren't being used, so I know there was. Some discussion at their meeting about, I think about Hilltop and Franklin House and. You know, I think they wanted to make sure that, you know, someone has a license, they're using it,
So
but,
that
right,
every other establishment would like some.
right,
like that.
so I think with, I think with Franklin Houses, they're, you know, I think they had some setbacks, but I think they're planning to get it open, so.
Okay. Or anything more with that? That was good.
Yeah.
Thank you.
Yeah.
All right, so your report, Tom?
Yeah, so, septic has slowed down a little bit, but still never comes to a halt. So did, 40 Birchwood since our last meeting, they did the whole shebang, the, perk final, and I already issued the COC for that one. That was just a repair.
Repair.
Yeah.
Final inspection and seal, okay.
Yeah, 58 Hastings, I, got all the documentation, issued the COC. 59 College Highway, that one, I forgot to take that one off, but that was that one,
59 College Highway's off.
the apartments,
Okay, that's done.
that was done, but he had to install it in segments, cause it was,
So it's done.
110 Summer Ave. That was a repair and I did the final inspection, still waiting for the paperwork. Actually, that was a,
What do you mean you're still waiting for the paperwork?
the sign offs, as I just did
you're
the
waiting
final
for it.
inspection a week or two
Okay.
ago, so.
Okay,
That one was interesting, it was a 2-bedroom. House, but there was actually for that neighborhood, it actually had a pretty big yard. So I think the owner wants to, make it a 3-bedroom, cause he's like kind of flipping it. So initially, the plan was just to keep it a 2-bedroom. But then they wanted to, the homeowner kind of changed his mind, I think, and wanted to make it a 3-bedroom, so we did. Right before they started construction, we did this, cause that's the only difference with a new to, repair. Is, you can't ask for any variances, which they weren't anyway, and you have to do the 2 perks to have the reserve area, so. And it was pure sand there, so when they, when they were just getting ready to start construction, they had dug a couple deep holes in a perk, and Randy White went back out and I met him out there just for a quick, like, 2-minute perk, and so they did that second perk after the fact, but
and Sumner Avenue's not on septic, huh?
yeah, not on sewer, yeah, that's
Sewer,
all,
yeah, sewer.
yeah.
Hmm.
Yeah, Summer, a lot of those streets, Lakemont's on septic, yeah, I think a lot of those aren't
Unhooked up.
hooked up, yeah. Maybe by the lakes, they're hooked up. Like on that very end of the street, the sewer line goes, but the further back, I don't think they are.
Did you ever take all those boxes down to the archive room or anything?
I've still got, there's a lot of them are down there, I've still got 3 boxes sitting in my office that I haven't taken down yet. But I can look in there. 173 College Highway, that one, that was a repair, did the final inspection and the COC. That one, they had to just dig up the system and put it right back where it was, cause it was, their backyard is a hill. In the front yard, it was a tiny little front yard, like barely off the road, but there was nowhere else to put the system, so. 5 Pine Knoll, that was a repair. I think I'd already inspected it at our last meeting, but I did the COC. Gargan Terrace, did perk final and the COC. That was, I didn't forgot to note that in there, but that was also a repair. 72 Granville Road, that was a repair, and also forgot to put in, that was a perk, and we just got the plan in. I haven't approved it yet.
Okay. So it was a repair per.
Yeah, and then 48 Birchwood was a repair perk, and I don't think we've got the
No
plan yet. No. 80 Bungalow Street, that's the one we talked about, in executive session last month. We don't need to go into executive session again. We don't need to go into all that detail again, but, it is progressing. There's still, heat's not restored, but some of the other violations have been corrected, and, it sounds like things are moving along. I don't feel like it's at a complete halt. If it does get to that point, I will be bringing this back up with you all, but, based on talking to everyone involved, I'm, knock on wood, pretty confident that it should be, at least significantly improved, by our next meeting. So food service, I haven't, I actually had a little time around Christmas, and I was like, I can't go in and do a food inspection. I'm sure everyone's crazy with takeout and all that. They will kill me. So I gave them a pass for Christmas. But that's New Year, and then grant coordinator. So I'll plan on by July, we should do 2 inspections a year. So by July, I'll plan to have inspected every restaurant in town. So finally get that done. That's been,
Hanging over your head.
yes. So that will be good to get that done. Meetings, we already talked about the positions. We already talked with the positions, we talked about the PHE meeting. And then I've been doing a couple OSHA trainings here or there. They're mostly free. They're provided by the town's insurance company. Have another one coming up next week. And that's all for this town safety coordinator part of my job description. And, it's interesting. So just kind of
Are you
learning.
learning how to read the diamond?
Yes, I think I did that and a little bit of that in one of them, but.
You had these in,
Oh.
this too, so I
Yeah.
don't know if you want to go over
Okay.
any of them.
So
Yeah,
if I have questions I can ask you.
yeah, sure. I might have to look it up, but I could, I know,
When I'm looking at the SDS and then trying to figure out the diamond,
yeah,
just
Yeah.
doesn't match up.
yep. Yeah, I'd have to refresh my memory on the diamond one, but the one I did already was, like record keeping. So the town, they keep the records more for insurance purposes, workman's comp. But you have to keep a separate OSHA log for every employee injury, and all that. So, waiting to get the information from the insurance company for all of our, not everything that becomes an insurance issue is necessarily an OSHA reportable. So I have to go through that and fill out the OSHA log for last year, and then moving forward, do it as we go.
So you're just gonna cover police, fire here,
Mhm. DPW,
DPW, library,
yeah,
but
yeah,
not the
school,
schools.
yeah, schools would be on their own for that.
And does that include any, nursing injuries while they're out and about?
I think nursing is included,
If it's
There's-
town nurses.
yeah.
That's right.
So, yeah, so it's, I'm still learning all that, cause that's not something I came experienced with, and I don't think it's something that's normally done by health departments, but, that was, the select board wanted to add that in when they made this position full-time.
Right.
So,
Is one of the ways we could get it. for some-
Yeah.
Sure.
yeah, so,
I think once it's all established,
yeah, it shouldn't be too much, but I don't think I'm the only one in the state. I don't think there's a lot of us that kind of have this responsibility, but I think there are a few others.
so you have to do the injury part, and then do you have to do like a chemical inventory?
Yeah,
All the rest
or
of
at
that,
least,
please?
kind of, so that was the other big thing, is we started the safety committee. So it, like, I don't know if I necessarily have to do the inventory myself. And
Or they all
my-
submit it.
yeah,
together, put it in one
Maya
place.
is the town's insurance company, is like Mass Interlocal Insurance Agency or something like that. And they have a lot of like self audits. So I think we're at our next meeting for the safety committee, we'll get into that and say, okay, Dave Sutton, just go through this audit and, see what you have, make sure you have your SDSs and then, some of them are geared specifically to police or fire or DPW. So I think we can kind of slowly go through some of those different things. I don't think I necessarily need to be the one inspecting every town building and going,
Find all the white out.
yeah, so,
There
but,
is such a thing.
but just kind of making sure the
A little thing.
appropriate department heads know what they need to know. So they can make sure that they're up to the OSHA standard, so.
No, at the hospital, if we have lotion, we have
Yeah.
to have that approved.
Oh, really?
Yeah, we can't just bring our own lotion in there. It has
Wow.
to be
Wow,
like,
That's
like
crazy.
housekeeping had to give us a lotion that they.
Yeah,
Right.
could use.
wow.
Wow.
I wish they would do that with the
Yeah.
cleaning stuff they
Yeah.
use here, it's so
Yeah.
toxic and
Yeah.
noxious. It can't be good for you.
Yeah.
The stuff they clean the bathrooms with, it smells awful.
You
Yeah,
can't get unscented.
I have no idea. I guess
Yeah.
I could ask the question,
but they
but
do have those,
little,
the scenty things
Misters?
like in the hall, like
Yeah.
those,
thank goodness this last month one was like cinnamon.
Yeah, it was
'cause
cinnamon. It
Usually
was-
they're
it was
so
nice, yeah.
sensitive to smells anyway, but
So yeah, I also included in your folders the budget report. And that we got some money left, which is good. But I think there was, some of the file cabinets were a little, oh, here,
Oh, here, I found
oh,
it.
yeah.
I found it, sorry.
Some of the file cabinets are like that one where the drawer you can't open.
Yeah,
first
well, you
one, yeah.
fixed it.
No, there's one of the ones behind Karen's desk. It doesn't, the
Oh.
drawer is messed up, so. I think I'll wait a little closer to the end of the fiscal year
Oh,
to
yeah.
make sure we don't,
The drawers.
yeah, make sure we don't need money, but, and I don't even know how much those cabinets cost, but. Was thinking maybe we would get one or two of those replaced, just
But,
because,
Is that going to be not minor equipment? If it's over a certain amount of money, is it no longer considered
I don't know.
minor?
Yeah, I can check with,
Laura will definitely.
yeah, I
tell you
can,
what to
I can
plug
check
in
with Laura,
When we do the, payable.
yeah. But yeah, so I could check with her before we do it, but that was one thing I was thinking of, but, and it's not like we have a ton of money to begin with, so,
Who we,
But you wanna spend it, so you don't
Right,
lose it.
right,
who did we use for a consultant? Was it Tom?
Crystal,
Crystal?
Yeah.
That's right, sorry.
yeah, she did a few inspections when I was on vacation.
Now,
So,
do you have, all the resumes and all the job descriptions and a letter of employments in that file cabinet?
I
across
don't,
from-
I don't.
Yeah,
have
they're
that.
there, they're there,
They're in the individual folders
Oh,
or
okay.
whatever.
Yeah.
You know what I'm talking
Yep.
about,
yeah, they're all in
for
there.
future reference.
So on the note of the budget, we do have two unanticipated items. Just this week, I got which I included the notice from select board for doing the annual town report. Which I can do that, but that's due February 6th.
Did you do that last year?
I think Tom did it last year. I think he did most of it, and then I think I sent it in for him, but
So Tricia, I think, added something last year. some
I think
kind of
so,
report.
yeah,
Probably.
yeah,
And then
yeah,
Megan can probably go or look to see
Yeah.
how many permits and all that stuff.
yeah, so we can update that. And then also we just got the email, which I can forward to all of you for the budget. accounting just sent that out. So the budget is due on February 2nd. So initially I was thinking we might have to do an extra meeting, but
Level
the
five.
first Thursday happens to be on
February
February
1st.
1st. So I'll do the budget and the report. I'll have them ready for our next meeting on February 1st.
And
You
the
guys
budget
can
just
review
level-
it.
Just level fund,
Okay,
right? We don't really need, luckily we have the grant.
yeah. Oh, and we were gonna ask, I'll probably put it in the 5-year capital budget, the inspection, or not inspection, the permitting software.
Yeah,
For 15,000.
You're not gonna get it if we don't ask.
yeah.
Oh, yeah, you can put it in.
So if they say no, they say no, but I'll keep asking.
Maybe if you
5-year.
keep asking, eventually.
Right.
I'll say yes.
Where it
Right.
away, where to,
Mhm.
where it down, where
Right,
it down.
so yeah, I'll do that as well, cause I know Kyle's gonna be asking for money for the he has to upgrade his permitting software, so maybe, hopefully, if we're lucky, they'll see, something that should be done, and if he's doing it, makes sense to do it all at once, but
If there's
they-
money.
yeah, so,
You can get a deal by doing both of you.
right, so,
I'm not quite sure how permitting software works.
it's all the permits are online. So people can come in, they can use a computer in the office, or they can do it, I think they have like they wanna do a paper permit, it's like a $5 fee extra that,
Otherwise, they just print it off at home.
right. And then, so yeah,
So
then they.
Karen puts it in.
Yeah, so Karen would type it in for them, but they would, all their certifications, they would upload. They would fill out all their information, it would let them pay online. And then it would, I would have to sign off on it, but it would automatically generate their permit. And then it would go for me to review, and I'd review them all and check, and then they get an email with their permit that they can print out.
Does Westville have that?
No, Westfield doesn't, not even for their building department.
So who has it? Other than our building department. I mean,
Building
Other
department,
towns have it.
yeah, definitely a few other health departments have it, and from what I've heard, I know they seem to like it. Some of them have the same one that we have here. And some of them, there's a few other companies that do it, but, and then even septic, those permits can be, so they can upload the plan, and that can all be done via e-permit, and then getting the submitting the sign offs when it's that point, and so there's definitely an advantage for like new construction with the building department, because a lot of the new construction houses are on septic and well. So there's that kind of back and forth where myself, John in planning, Sabrina in conservation, treasurer collector, they all have access to the building department e-permitting software because they have to sign off. So I think if sometimes it can be a little difficult when the building is asking for a sign off, and then I'm going into our paper records to check things, but so I think if we were both on that could kind of streamline things a little bit for certain cases, so definitely an advantage, and I would think if they have the money for it, I would think they would like to do it. I think it would be good for,
It'd be nice even with their certifications.
right,
50% of the restaurants that came in with the application in
Yeah.
effect. And said, here you go. And I'm like,
yeah, oh, we need your
"Kids, read
certification,
this. We need the other, well, you have it already.
right,
I'm like, yeah, but I'm not gonna pull apart the file and make copies. You need to it says to bring a copy of it. So it would be nice to have them just,
yeah,
we had one place it was a picture of the framed
yeah,
certificate.
Yeah.
I'm like, we'll take it.
yeah,
But they
so,
just really didn't,
right,
didn't read the paperwork. I mean, some
Right.
of them needed to see the previous application to
Right.
fill out the new application, and it's like, it's just your address and your manager. But they just,
yeah.
oblivious to it, I guess. I don't
Yeah.
know.
The Serve Safe is good for what, 3 years, 5 years?
I think 5 years.
Yeah, because some of them
Yeah,
have submitted in the past and they're.
right,
Yeah.
right. But I think too, if they had, I don't know exactly how I've seen how the e-permitting works for building and it would, you know, our permits aren't exactly the same as theirs, but, it would probably be easier for them to just upload their current ones and they, like now we ask for them to resubmit it every year, but if it's all online, it would probably be easier to just say, oh,
Oh, it's there.
yeah, that one's still
Yeah.
good, you're
Yeah.
good.
Right.
So I think, from what I've heard, my brother works for the Tri-Town, which is Lee, Lennox and Stockbridge Health Department. And they have this same, Permitize software that building uses, and they said the first year was rough. Cause people don't like change.
Mhm.
But after that first year, now it's so much easier. The restaurants don't complain about it. They all like it. It's, you know,
Yeah.
simple and straightforward, so. So yeah, I'll put that in the budget, maybe probably in the capital 5-year, but, who knows? We'll see what happens, but, so I'll have that. I'll forward you the email I got from accounting with all the budget information. But I'll work on that and I'll have it ready for our next meeting for you guys to approve, and then I'll get that submitted in time to the select board.
Okay.
And that's all I got.
Mackenzie, do you have anything to add or anything to ask?
No, I'm good, thank you.
How about you, Terry?
I am good.
All right,
Okay, so make a motion to adjourn
I move that we adjourn.
at, oh, it's like 7:45.
okay.
Second, all in favor?
Mackenzie Kane, yes.
Terry, yes.
Aye.
Dubrasky, yes. Thank you. See you February 1st.
All right, thanks.
Stop recording.